And welcome back. I'm Mabel, Jong, and we're continuing our discussions about venture capital in the healthcare sector. In our studio right now, Dr. Dan Gebremedhin, who is a partner of Flare Capital. And Dr. Gebremedhin, it's so great to see you here today.
Thank you for having me.
Okay, so what do you think about your role in this area? What excites you most about the kinds of different ideas that you're hearing about and learning about?
Yeah, so I'd say, my unique background, I think, plays a large role as to how I approach the job as a venture capitalist. Traditionally, venture capitalists invest in entrepreneurs' companies, and that tends to be it. They serve on the board, they provide governance, and they provide capital. Prior to my role at Flare Capital, I was an executive at a health plan, and I was also an entrepreneur in the health IT industry. And so believe that I bring a lot of strategic insight and assistance to our entrepreneurs, can help them struggle with key strategic issues around business model. The other unique aspect about Flare Capital is that about 2/3 of our capital we actually raise from large healthcare corporations. And so these are large health plans, health systems, pharmacy benefit management companies, so we can bring that strategic insight to the table as well in assisting the entrepreneurs as they grapple with some strategic, decision points, but they can also be helpful with, generating new customer interest. And then as a venture investor, we oftentimes will help our entrepreneurs recruit world-class members to their team, as well as business development.
How hard is it to avoid the tendency to just sort of invest in the technology without really knowing what the problem is that they're trying to address?
I do think that there's a big risk, and especially in our industry where groupthink is so powerful, you hear a lot of the times what someone else is doing, and technology can be quite buzzy, right? Certain technologies like AI, blockchain, kind of big data, if you will, can be quite alluring. And so I think, as strategic investors, we focus exclusively on major problems. And I think the big areas of focus for Flare Capital are solutions that are lowering healthcare costs, improving outcomes, improving quality, and increasing patient satisfaction, engagement, and activation in their own healthcare.
Okay, and you're a doctor by training.
Yes, I actually practiced medicine up until recently, up until actually last month.
Okay.
I finished my medical training in 2010, and so for the last 8 or 9 years have been practicing part-time while I maintained a full-time career as I mentioned, a health plan exec and at Flare Capital.
Okay, that does give you unique perspective, right? Having that inside baseball knowledge, if you will, about what the industry is undergoing right now.
Yeah, no, I think being on the front lines does add a unique perspective. Again, you're in the quote unquote in the trenches, right? And so you understand from a workflow perspective how technology can either help or can hurt. Kind of clinicians as well as operational staff on the front lines, and then you also understand how patients think about their care. What problems they struggle with, what opportunities there are, and so I do think my operational background, having worked at a health plan, and then as being a practicing clinician, I think does add a unique perspective to investment decisions that we make.
You sat on a panel talking about venture capital. What are some of the takeaways you want to leave with our viewing audience?
So our investor panel was actually focused on this concept of return on investment. And so we had a really great discussion around how do you position your product to realize the potential that you might perceive, but sometimes your customers may not completely understand. And so sometimes it is around how you do the analysis, how you structure and how you arrange the product or service within the business model of your potential customer. Because ultimately, entrepreneurs are coming up with great ideas. But I think sometimes you need to package them correctly. You need to have a right revenue and a right business model to allow real adoption in the market.
Okay, all right. And how are you finding the Congress so far?
Oh, it's been an amazing collection of executives, regulators, kind of keynote speakers, as well as entrepreneurs as well. And so I think it's conferences like this that I think really move our industry forward, bring very, very talented people together to struggle with some of the major issues and the opportunities in the healthcare industry.
Thanks, Dan. Really appreciate your time today.
Thank you.
And I'm Mabel, Jong. Thank you. Stay with us.